So you're finally ready for that first therapy session. Great. But where do you start? Great question. Let's talk about it. In this video, I'm going to give you 2 quick things to think about prior to that first therapy session. But hey, if we never met before, my name is Dr. McCleary, and I'm a licensed clinical psychologist and Navy veteran. And my content is dedicated to educating veterans and their families about mental health. So if that's you, consider subscribing. A lot of people seek out mental health services because they're just not doing well. They're feeling low, they're feeling down, or they're generally feeling some way they don't want to feel. Or they're thinking a particular way that they don't want to think. Okay. Well, there can be a lot of different reasons for all of that. But what you want to find out is what you actually need to be working on. And your therapist will help you get there. But it's something important to think about prior to that first session. What do you actually feel like you need to work on? This is a question I ask all the time, because it's not just my job to figure out what's going on. Part of it is your job as well, and we're going to figure it out together. Thinking about what you want to work on is important prior to even that first session. And something to think about is, well, what's bothering you the most? What do we need to be focusing on? What is the thing that is bringing you to treatment? If you can already come in with that in that first session, you got a good head start. The next question I want you to ask yourself, and something to think about, is what are you actually willing to work on? Not what do you want to work on? Those are often different. What are you actually willing to work on? What are you willing to talk about? It's very difficult to, in the first session especially, to start spilling your guts to a complete stranger. I get that. I work in the field of trauma. And often the last thing that anybody that has experienced a trauma wants to talk about is the worst time ever in their life. Makes perfect sense. And maybe somebody isn't ready to unpack some of those traumas. Maybe they're not ready to talk about certain things. That's okay. What you do want to ask yourself, though, after you figured out why you're coming to treatment in the first place, is what are you actually willing to work on? Because I've never met anybody that comes to talk to me and is excited to tell me about some bad stuff that's going on. That's not how it works. The reality is, nobody wants to come see me. 2 things. Think about what you want to work on, what you need to work on, what's going on for you right now that's causing you the most issues. And 2, what are you actually willing to work on? What are you willing to do? If you can come in during the first session with those 2 things, you're going to be off to the races. Off to the races to recovery. Something to think about. If this video was helpful for you, please like it or consider subscribing to my channel if you want to learn more about PTSD and mental health. But more important than that, if this video was helpful for you, well, that means it can probably be helpful for another veteran or another friend or family member of a veteran. So I ask that you share it with them. Because at the end of the day, that's really what all this is about. One veteran, trying to help another.